Hi, good morning. My name is Dr. Rajat Nan Ahmed, and I am a consultant psychiatrist working in UK. And with me this morning is Dr. Rubia Abrar, who is a consultant child psychiatrist also working in UK. And this is part of a series of interviews I like to do with some different consultants of psychiatry working in UK in different subspecialty. The idea is that I like to give IMGs a bit of flavor of how is it different to work in different subspecialties of psychiatry, which is one of the common questions the IMGs ask us. So first of all, Rabia, thank you very much for joining me and giving your time.
You're most welcome. It's a pleasure.
So the first question people might ask is that what is a child psychiatrist?
So, what is a child psychiatrist? Child psychiatrist is somebody who has done cohort training and then has spent another 3 to 4 years in higher training in just child psychiatry and various other areas of psychiatry. And then they choose child psychiatry as their sort of career there onwards. Yeah.
And I think it is obvious that child psychiatrist means that you treat the children, but is there any age limit that you particularly look into of patients?
So there are services across UK. A standard is 0 to 18, but there are some services that extend to 18 to 25 as well in child psychiatry, depending on if the young person has any learning problems or neurodevelopmental problems. So they kind of extended into child psychiatry and young people psychiatry. But its standard is not to 18, really.
All right. And the next question was, how do you train to become a child psychiatrist? I think you just answered that in the first bit as well, a little bit. Would you like to say a bit more about that? And how do you train to become a child
Yes.
psychiatrist in UK?
Yes, most definitely. So you do your core training as you do for every specialty in psychiatry. Then you obviously during that process you do your exams. And when you are when you've done your ST3, you choose to whatever specialty that you need to do. And child psychiatry is another 3 years. I did it sort of flexible because I had little children, so it took me around 4 years to finish that. And in that, get a flavor of outpatient work in child psychiatry, you get a flavor of inpatient work in child psychiatry, you get a flavor of psychotherapeutic inputs in child psychiatry, including family therapy. So you get different placements. You also get a child LE placement if you're lucky. So you get an overview of holistic child psychiatry services in those 4 years.
All right. So it's important to mention that you see the child psychiatry training is done for 3 years. The core training itself is for 3 years, and during the core training, IMGs can actually some trainees can actually go and train in child psychiatry for 6 months. Some don't get that rotation, but some do. And recently, Royal College has started a program where you can actually have a run-through scheme as well for a whole 6 years of, you can train as from ST1 to ST6, get a run-through scheme in child psychiatry. Even in that, you will have to achieve your core competencies for the first 3 years, so you will have different rotation within different subspecialties of psychiatry, and the last 3 years would be for the child psychiatry. So one of the common things that get asked here, how is it different from adult psychiatry? Because there are a lot of places we only practice adult psychiatry in the world. How child psychiatry will be different from an adult psychiatry?
So it's I think the basic difference is that your patients are not adults, they're children. And you see children day in, day out. Back in, when I first started doing child psychiatry, it was called child and family services instead of child and adolescent services. So which means that some families who have problems and issues, they would come to us as well as a referral from, let's say, social care or some other specialty in medicine or their GP. But now it's obviously children. So precisely the main difference is your patients are children within the ages of 0 to 18. That's it.
And what are the common conditions you normally see as a child psychiatrist?
So it's variable, really. And just like adult psychiatry, you see all those presentations that you see in adult psychiatry almost in children as well. There's depression, there's a lot of anxiety, there's OCD. There are children who come with Tourette's and tics. Neurodevelopmental difficulties, again, you've got ADHD and young people with learning problems, processing difficulties, sensory problems that come to you. So some child psychiatry services within the UK cover all of that. Some have divided as in that the neurodevelopmental, particularly ADHD, is taken care of by pediatrics in that area, and the rest is taken care by psychiatry. So, depending on how your area is doing it, you cover everything basically.
And if we have to ask you to describe your routine day as a child psychiatrist, can you share some insights into that?
So yeah, my routine days. So I have divided my week into clinical days and non-clinical days. The non-clinical days are mostly where I do, well, they are clinical meetings, the multidisciplinary meeting that takes a lot of time, almost a whole entire session once a week. Then I have the psychiatry meeting, whereby the entire team and other staff who make a referral to psychiatry, we kind of go through them and triage those referrals and allocate them. And then I have supervision time on non-clinical days where I provide supervision to other doctors and nurses who work under me. And then the clinical days, I have divided them into one day where I do all initial assessments. Well, this is currently under the COVID regime because we're not allowed to come into clinics every day. So we do a lot of Zoom clinics, so we're doing them from home. But all my initial assessments are done one day, whether there are 2 or 3 of them. They're one day a week. I finish them all off. And then the rest of the week, I have slots where I do reviews in the morning and reviews in the afternoon, and that's basically it. And one day a week, like all other psychiatrists, we get for SPA, whereby we do work on our PDP, personal developmental programs and courses and meetings.
And what about the on-calls? Because that is an important consideration for a lot of people, that how frequent would be the on-call, the weekends and nights?
Absolutely. I think that depends entirely on what area and what trust you work in. If your trust is big, each area that you're covering, you would probably have lots of colleagues to share your on-call with, which means your on-calls will not be frequent. If your trust is small and the child psychiatry bit is very tiny, they might have as frequent as 1 in 5 on-calls. Mine at the moment are 1 in 7, which is not bad at all. And then because we have tiers in the on-calls, we have the junior doctors, then we have the CRI team, then we have the managers. I'm kind of like the top tier. It's not a very busy on-call, if I'm honest.
Okay. And what sort of settings are there for child psychiatrists? You mentioned that you do a lot of clinics and meetings and you're based in the community. Are there any other settings child psychiatrists work in?
Yes, there are. So child psychiatry, again, it depends entirely on what you've chosen to do. If you've chosen to do outpatient CAMHS, which is called community psychiatry, you will be mostly based in a multidisciplinary team in the community that has psychologists, that has nurse therapists, that has, I don't know, speech therapists. Some are part of a bigger team, some are part of a small team. So we work in a team where I've got all the psychological ingredients, and then downstairs of our building, we have another trust that is also providing related pediatrics and hearing and audiology and all the other child-related services under us. So basically, that's the community setting. And then if you're doing for psychiatry in child, which means inpatient psychiatry in child, that's an entirely different posting. That's a posting where you're doing constantly inpatient consultant work, where you might have 10 to 14 beds of informal admissions. And then you might have PQ, which is psychiatric ICU care, which might also have 10 to 14 things in there. So that's another sort of option to weigh.
And regarding the job satisfaction, what aspects of your job you enjoy, and is that something you want to share with us?
So it really depends on what you're into. There's a lot of people I know who enjoy the administrative part of their jobs, and they like the meetings, and they like to take on administrative roles. I do like, I must say, I do like the clinical side of my job and teaching training side of my job. So there's a lot of opportunity with regards to teaching training. I mean, right now I'm part of online teaching training at University of Cambridge medical students. So I provide them sort of lectures around child psychiatry, whenever a slot comes up. And obviously teaching training in terms of examination, examiner in various medical colleges, medical schools in London. I participate in examination. So that's the bit that I really enjoy. And of course, the clinical side. I think each day that I see clinic, seeing a new patient is a new experience. There's not a single boring day. There's no monotony because, it's just fantastic working with children, I think.
And what is the scope of private work in child psychiatry? Is that something that you have looked into or considered?
Well, I had thought about it, but I think it's become quite difficult. And also, I think time-wise, I'm kind of restricted with my family and other responsibilities. So I don't have time for it. Plus, there's a lot of sort of conflict of interest if certain trusts, I think all trusts at this point, ask you to declare conflict of interest, which means basically you cannot be doing private work within the catchment area of your trust, which could be quite a lot of area, which means if you did want to do private work, you'd have to go quite out of the way in another county, perhaps, to do some private work. So I don't think I'm that motivated, but I'm sure there's opportunities out there.
So if somebody is a young doctor is thinking about becoming a child psychiatrist, what would be your advice? How would you sell this specialty to them?
I would say, Nana, if I'm very honest, I'd say whatever specialty that you wish to take, whether that's child psychiatry or adult or old age psychiatry, you must remember that this is like choosing a spouse. This is for the rest of your life. So you have to make an honest decision to yourself that this is what you enjoy doing and you will continue to enjoy doing for the rest of your life. It's not something that will bog you down. You will feel coming home, oh my God, I've come out of a terrible day. That's how it should not be. So whatever specialty you choose, it should be something that you want to commit to for the rest of your life. And for me, I think that is the main thing. I think working with children keeps me really involved, and it's a new learning experience, and helping them when they come out of their troubles and their diagnosis is sort of then in remission. I feel really gratified, and I think this is really wonderful to help them at that stage and not develop into coronal illnesses.
Okay. Thank you very much for sharing your experience and all the advice. The last question, a lot of people will ask us around the scope of child psychiatry abroad. So if somebody is trained in UK, have you have experience of people going out abroad and working and making good lives for themselves?
Yes, I mean, I know some of my colleagues who've gone child psychiatry and then gone to Australia and New Zealand, where they've got beautiful jobs awaiting them, extremely good packages. More recently, people have contacted me actually to come to Riyadh and Qatar for jobs that are in their hospitals. Extremely attractive package, I must say. There are jobs out there for certain, and particularly if you've done enough time and training in the UK, if you've spent about 4 years or 5 years as a consultant here, there's a lot of encouragement from Middle Eastern countries for taking up jobs there.
Thank you very much for all your time.
You're welcome. Thank you very much for having me.